But unfortunately, the effect of these strong state pro-life laws is not going to be as strong as it could be as long as these bad actors in pro-abortion states are going to continue shipping these pills in.
Welcome to Caring for Both, a curbside consult series by the American Association of Pro-Life Obstetricians and Gynecologists, or APLOG. On this podcast, we bring on experts to provide insights to support you as a medical professional in your life-affirming practice and career. I'm your host for today, Rebecca Weaver, APLOG's Director of Advocacy and Policy. One of the main reasons that pro-life advocates are in this fight, whether we specialize in medicine or policy, is to see the number of induced abortions decrease. There are a lot of factors that influence those abortion numbers, and in this new post-Dobbs environment, we're seeing a rapidly shifting landscape that makes it hard to see what it's going to take to end the practice of intentionally killing preborn children. Here to offer some clarity is Melanie Israel. Melanie is a visiting fellow in the Richard and Helen DeVos Center for Life, Religion, and Family at the Heritage Foundation, where she focuses on policy analysis and development related to life, conscience rights, and religious freedom. Melanie has published op-eds for a variety of media outlets, including USA Today, Sacramento Bee, Orlando Sentinel, Des Moines Register, and many more. She has also appeared in numerous media outlets, including EWTN, CBN, The New York Times, The Wall Street Journal, and Politico. Prior to joining the Heritage Foundation, Melanie worked on Capitol Hill in the office of Senator Ted Cruz from Texas and in the Senate Judiciary Committee. She received a bachelor's degree in history from the University of Texas. Melanie, thank you for being here.
Thank you so much for having me. I'm looking forward to this conversation.
Yeah, so let's just jump right in. To start, we read your bio, so we know the formal bit about yourself, but why don't you just tell us anything else about yourself that you want to add to that and your work at the Heritage Foundation?
Sure. So at Heritage, I've been there since 2016. And so I have been handling all of those different pro-life issues. Specifically, most recently, things about the abortion pill, abortion data, kind of what we're seeing happening after the Dobbs decision. And we, of course, offer policy analysis and advice for both state and federal policy. And so we're definitely active in both of those spaces.
Yeah, and data obviously is so important to coming up and crafting policy. And the abortion numbers we see are impacted by a variety of factors, even when we're only thinking about policy. And so what are some of those factors?
Yeah, it's a great question. And I think one of the things that we have to recognize when we talk about abortion data is that this conversation from the very beginning requires a lot of caveats. So, most often when we talk about abortion data, we're using numbers from either the CDC or the Guttmacher Institute. The CDC collects abortion data each year. However, not all states participate in that annual report. The 4 states that don't, California, Maryland, New Jersey, and New Hampshire, they all have very loose abortion laws. So obviously we know that there's a huge chunk of data missing in those CDC reports. The Guttmacher Institute, they're a pro-abortion research organization. They survey abortion providers directly. And so every 3 years, they put out an abortion provider census, and their numbers are always significantly higher than the CDC's numbers. And they get data from those 4 states that don't participate in the CDC report. But again, they're a private organization, and so we have some of their methodology, but it's not public information in the same way that the CDC's is. So with that being said, anytime we're talking about this data, we have to have those caveats. We don't know what we don't know. But with all that being said, there's a couple of things that significantly influence what the abortion numbers are going to be. Obviously, in states with very protective pro-life laws, their abortion numbers are going to be much lower than, say, Illinois, New York. That's kind of stating the obvious. But one of the other things that you have to take into consideration is what states are bordering other states.
Mm.
So, for example, in Texas, where you and I are, Texas enacted very protective laws even before the Roe decision was overturned with their heartbeat law that had gone into effect back in 2021. New Mexico, which neighbors Texas, has no gestational protections for unborn children, and they are actually an abortion destination for many women in Texas. And so, an example of what you see is that in Texas, we have these very protective laws starting in 2021. However, in the CDC's most recent annual report, we saw that their abortions more than doubled
Mm.
from one year to the next. And we also saw that their out of state residents seeking abortions in New Mexico skyrocketed. And so, what does that tell us? Well, it tells us that women in pro life states still can and do travel to these other bordering states with very not protective laws. And so, that's a dynamic that we are going to continue seeing. For a long time, that was also the case in states like Florida and North Carolina. Actually, immediately after the Dobbs decision, their abortion numbers went up significantly as well. And so I do have to also clarify the CDC abortion data only goes through 2022. And so 6 months of that data includes that post-Dobbs environment. And so while many states did have laws that sprang to life immediately after Roe was overturned, other states, it took time for their legislatures to actually go and pass those laws. And so here in the coming years, we're going to start seeing what those numbers look like in 2023, 2024. For example, in 2022, Florida didn't have its heartbeat law in place. And so we will definitely continue seeing how those numbers play out. One of the other things that is really important to keep in mind is that the vast majority of abortions today are done using the abortion pill, which I know your members are very, very familiar with. And over time, we've been seeing more and more and more abortions occurring before that 6-week mark. Because in the CDC annual reports, they track these windows of gestationally when abortions are being performed. And you can compare the charts of as the incidence of abortions that were pill induced went up and up and up, especially as the Biden and Obama administrations weakened safety protections, that portion of abortions that occurred at or before 6 weeks was also skyrocketing. And so, even in states where you have perhaps a heartbeat law in effect, that law is absolutely protecting thousands of babies each year. But as long as those very early pill induced abortions are an option, there's still going to be, unfortunately, many thousands of abortions performed before that kind of 6-week marker. And so that's where things like regulations on these dangerous and risky pills comes into effect. And it's definitely a state by state conversation of what they need to do depending on what's on the books right now. But I hope that provides an overview of all of these different dynamics that are going on. Also with the caveat that when we're talking about the CDC data, we're only looking through 2022.
Right. No, that's so helpful, so interesting. And I think it's frustrating when we look at the data or you share about it with someone because there are all these caveats, but that's just the reality. Now, I think that's a great springboard for another question is, when talking about all of this, we're trying to weigh competing narratives about the impact of abortion laws. And one narrative we hear is that pro-life laws don't actually bring down abortion numbers, that, pointing to Guttmacher's research showing abortion numbers actually went up to over 1 million in 2023, which was the first full year after Dobbs. So what do you make of that number and of that narrative overall that abortion laws aren't actually even having an impact?
Yeah, so I think there's several different things we need to consider. And of course, like we said, the CDC numbers and the Guttmacher numbers differ for a variety of reasons. With the CDC numbers, we've definitely seen abortions falling. However, that enduring decline definitely started to reverse around the 2016 timeframe. And of course, that's when the Obama administration weakened protections for the abortion pill. And so when we talk about these numbers and especially claims that abortions are actually going up, I think we can't have that conversation without talking about the abortion pill because not only are these so-called abortion sanctuary states like California, they are going out of their way to increase the number of abortions that are being done. They are going out of their way to try to bring women from pro-life states to California. You also have bad actors like the abortionist up in New York State who has been, willfully sending these dangerous abortion drugs into pro-life states like Texas and Louisiana, where right now both attorneys generals in those states are trying to hold her legally responsible for breaking the law and for harming women and babies. And they are, running into conflicts with New York State, who is trying to protect her from any responsibility. And so that's going to continue playing out. But, unfortunately, with these abortion drugs that are flowing into pro-life states, we don't even know for sure exactly how many are coming in and exactly where they're coming from. There's these bad actors, not just in the United States, but also overseas, who don't really care what state laws are, frankly, who are sending these pills in. And so unfortunately, I think as long as we have a policy of basically the Wild West of allowing these abortion drugs to be sent through the mail, telemedicine appointments, all of that, we're never going to be able to say exactly what the data shows because we simply don't have that data. But I do think that for organizations like Guttmacher who are able to get information from abortion providers who don't, talk to their local state health department, I think it is very revealing and very telling. And I think it's definitely something that we can infer that these pro-abortion doctors and these online pharmacies are writing prescriptions for these pills and sending them to women in these pro-life states. And so when you see, a pro-life state health department report come out and it says, well, we had 0 elective abortions to report this year, that is wonderful. We know that there are hearts beating today that wouldn't have been otherwise because of that state strong pro-life law. However, we also know that there is a bad actor at one of these sketchy telemed pharmacies in California who has probably shipped hundreds of abortion drugs into that pro-life state. And so again, we don't know what we don't know, but unfortunately, the effect of these strong state pro-life laws is not going to be as strong as it could be, as long as these bad actors in pro-abortion states are going to continue shipping these pills in.
Absolutely. And I think that's another narrative we hear, right? Is that, well, there aren't any abortions happening anymore in pro-life states. And like you said, the official data might show that, and that is to be celebrated, but we still have a lot of work to do, whether you are in a pro-abortion state or a pro-life state. There is still a lot of work to be done to protect moms and protect babies. So with that, what are some of the policies that pro-life advocates should be looking to make for an impact on these abortion numbers in our post-Dobbs world, both federally and at the state level?
Sure. I'll start at the state level. Many pro-life states had already taken action even before the Dobbs decision to try to tighten their state laws about the regulation of these abortion drugs. Of course, each state, they need to go in and look at what their laws are right now, and make sure that their state is not relying on federal policy of what the FDA says, because we've seen repeatedly, both under President Obama and President Biden, that they weaken those regulations over time. And so states need to step in. They are absolutely empowered to regulate healthcare within their borders. And so being sure that we have protections in place for these dangerous abortion drugs is going to be key. One of the other things that states can be doing is to make sure that women know about the possibility of abortion pill reversal. And that can look like a lot of different ways, even something like a public awareness campaign or something, making sure that women know that that is absolutely an option. Because we do know that, if a woman is in crisis and she orders abortion pills online and she takes the drug at home and she's never really actually even interacted with a doctor or talked to somebody about her distress, it makes it that much more difficult for, say, a pregnancy center to be able to come alongside her and help her. And so we need to make sure that a woman just on her own, who's never even interacting with somebody else, is able to see maybe online or on a billboard something, that she's aware that abortion pill reversal might be an option for her. Also, making sure that states are supporting pregnancy centers and the work that they're doing. Again, with these abortion pills flowing into pro-life states, it makes their work a lot different. If they are able to be interacting with these women experiencing a crisis, so often now the conversation is not, oh, I'm pregnant, I'm scared, I have an appointment at Planned Parenthood next week.
Mm.
They're calling and saying, I'm pregnant, I'm scared, I have the abortion pill in my hand right now.
Yeah.
And that absolutely changes the conversation and the dynamics. And so making sure that pregnancy centers are supported is going to be really important. And we actually see, unfortunately, some of these pro-abortion states not only trying to help abortion providers and import women from other states to have abortions, but they're also going after pregnancy centers who are trying to offer a helping hand to women. And so those are all things that we need to be keeping an eye on. And of course, at the federal level, at the FDA, that is really where the Trump administration can and should step in and make a big difference. One of the, I think, most low-hanging options is to, at the very least, restore the protections that were in place during President Trump's first administration, where the FDA did not put a stamp of approval on things like telemedicine abortion and abortion pills by mail. At the very least, they can and should do that. But they also need to be going back and looking at the safety of these pills themselves. We know that the approval process for these pills was politicized from the start, that ideology took precedence over women's health and safety. And again, one of the bare minimum things that they should do is to start requiring, once again, that these serious adverse events are reported to the FDA. And we saw this play out in the Supreme Court case that I know so many of your members are familiar with these abortion drugs. When the FDA started loosening safety protections for these pills, they were pointing to their data saying, well, we're just not getting a bunch of reports of these serious events, so the pills must be safe. Well, they're the ones who stopped requiring that these serious events be reported. And so you can see how that kind of twisted logic is, of course, going to get the pro-abortion proponents what they want. And so I would definitely say, at the bare minimum, they need to restore the protections that were in place under President Trump. They need to restore the requirements for reporting those serious adverse events. And they need to go back and actually look at the safety data and see what else needs to be done to restore those protections.
Yeah, that's great. Like we said, there's still lots to do, and that doesn't negate all the advancements we have made as a movement and in the States, but there's still lots left to do. So thank you for all of that, Melanie. Where can people go to follow you and your work?
Sure. So I publish research at heritage.org. In fact, I've got two papers in the editing pipeline that should be coming out imminently, including one about dangerous abortion drugs and what's next and what we should be looking for, and also a recap of all of the anti-life things that the Biden administration did. And going forward, we'll be doing more on what President Trump can and should do to protect life, what Congress can and should do to protect life. So all of that will be at heritage.org. And then I also do commentary at the Daily Signal. And so for those different, newsworthy events, I'm able to post commentary on those things. And so lots of things to discuss here in the coming months for sure.
Right. Awesome. Thank you for that. And thank you for joining us today, Melanie. It's been so good and informative. And thank you to our listeners for joining us today. If you like this episode, be sure to give us a like and a subscribe on YouTube, or if you're listening on a podcast app, give us a 5-star review. Also, help us continue to clarify in the midst of confusion by considering donating to our C3 or C4. We can only keep doing what we're doing with your dues and your support, and we will see you on our next episode. Thanks.
Hi there, this is Miriam Diallo, AppLog's Communications Manager, and before we close out today's episode, I wanted to quickly show you an exciting new video that our team at AppLog recently produced. It explains AppLog's history and purpose within the pro-life movement and encourages all pro-life medical professionals and allies to mobilize behind pro-life physicians as they forge a new path forward in medicine. Here it is. Hope you enjoy.
There's never been a time in AppLog's 51 years of existence that it was more important that we exist than right now. We can be effective within the pro-life movement in a way that no other organization can be. We were established as a special interest group within the American College of OBGYNs. That special interest group actually then quickly became the largest and remained that way until 2013 when ACOG dissolved the title of special interest group.
And so even though we've been around for 50 plus years, we formally became a second organization to be a different voice that no longer could speak within ACOG.
What we have seen over the last approximately 20 years is that ACOG, the American College of OBGYNs, are throwing aside sound medicine, evidence-based medicine, in favor of this ideological agenda of abortion with no restrictions, no barriers, no limits whatsoever. And I see that being harmful not only to our patients, but to our profession.
I don't think a lot of practicing physicians are aware of just how bold ACOG has been regarding the blatant lies that they're telling related to induced abortion.
Our voices are so important right now because of the lies that are coming out of the medical field that are scaring people into supporting abortion when they otherwise wouldn't. That has spurred us on at AppLog to speak truth to fellow medical professionals and to speak truth to the culture that induced abortion is not healthcare. It ends the life of one of our patients, and it oftentimes causes significant harm for our other patient.
If we didn't have AppLog's voice, there would be one narrative, and that narrative would be that the direct and intentional killing of one of our patients is normalized in medicine.
With AppLog leading the charge, doctors can make a difference in this fight for life. We are speaking up louder and more boldly for the truth and for the lives of both of our patients. We're doing that by providing alternatives for medical students to go to life-affirming residency programs. We're doing that by actively seeking out ways to get the truth out there in medical journals, in the media, and in the court of public opinion, instead of people just being fed the false narrative that the pro-abortion lobby would like for them to hear. And we're seeing that that makes a difference. We're seeing wins in states now where doctors are speaking up. Our membership is growing. We are serving as an example to groups all over the world.
The one thing that gets me most excited about the future of AppLog are the actual doctors themselves who are waking up and starting a revolution and saying, no more, you do not get our profession. We need every single one of those voices out there, and AppLog is leading the way. AppLog is connecting individuals to the needed resources to be the voice for their practices, their hospital systems, their local communities, their states, and this nation.
We have plans in place to reach physicians and medical students in every state in this country to get them into their state houses, talking to their lawmakers, testifying about the impact of abortion on their patients, and continuing to spread the word to women out there who are facing unplanned or complicated pregnancies that we are there for both you and your child.
AppLog is an organization that gives its members courage. This isn't an easy battle. It's every day. Sometimes it feels like it's every minute. To know that there's an organization that is in the arena, in the battle, gives me great confidence to keep fighting.
We are the ones who represent true medical advancement, true medical science, and the way that medicine was meant to be practiced. We need people to join with us to help us mobilize and equip our physicians to go out and be a voice for life and a voice for change.